Mohanty, Managing Director, Kalinga Hospital, to please speak a few words.
Thank you, Mr. D.K. Roy. Dignitaries on the dais, ladies and gentlemen, I stand here not to say that what we have achieved or anything. I'll just speak a few words about what actually ails healthcare and how it can be solved by telemedicine. Firstly, the Honorable Health Minister has gone, but I'd like to, anyone who looks after the healthcare is something can be equated to peeling an onion. पियाज जो काटिबे आखिरे लुह बाहर आ भितर कौन अच्छी जना पड़ोनी. Health care, when you look after health care, that is what is the problem. आखिरे लुह बाहर कारण डाक्तर मिलू ना जो जहाँ मंत्री महोदय कहले से गुड़ा सब सत आ से जो दुखटा जो आखिर लुह बाहर आउे भितर कौ रंगर पियाज गोटे चोपा आप छड़ेदे ता भितर आउ कौ रंग अच्छी जना पड़ूना. So सेटा केमती दूर हम बोधे telemedicine is the answer. And now what I am going to tell you, I'll just take about 2 minutes. Actually what has happened these days, we are talking the ills of healthcare, which we all have enumerated. A lot of top people have said what is the problem. It has been studied by many committees, many leaders have spoken a lot about it for past 6 decades. One Bohr commission came and we are waiting for the Bohr to come back again, the dawn of the morning. And there have been all sounds and fury, but no action. NRHM or whatever it is, nothing has happened. The recommendations once made are always applauded, we clap. But seldom it is implemented. Meanwhile, the fast changing environment, the socio-economic, demographic, technological and global constantly outstrips the program of Medicare. It will always be given a priority 3 or priority 4. Priority 1 may be how to dig mines. Now, provision of health care through telemedicine can be viewed through windows of only 3 things: access, quality, and innovation. All 3 things we can get is from the telemedicine. All 3 views now are very depressing. Our quality has gone down, access is not there, the doctor is not going, innovation is 0. When you talk of telemedicine, as Professor Mahapatra rightly said, he was bold enough to admit that he was ignorant, but he was fast enough to understand the benefits of the telemedicine. And as I have benefited from telemedicine when I was in Siachen, that is a time when no doctor was there, but through telemedicine we could get the benefit, and it is still existing. And I was just telling Mr. Bedi in the morning that the operations in Kashmir, 2 commanders spoke to each other, not from their operation rooms, from 2 hospitals, because the hospitals were well connected by telemedicine. There's a need to evolve out-of-box solutions to the increasingly vexed and worsening problems in healthcare. How we do it? It is a telemedicine, but telemedicine has to come out of certain things. We have to have certain thinking, the clinical aspect of it, the legal aspect of it, the operational, economic, and organizational. Just by saying that we have telemedicine, no, it is just not possible. Now, when you go, what telemedicine must provide? Lalu, Mr. Bhagat is my very old friend. When I talked to him in Kalinga Hospital, I always say that for telemedicine, because of your initiative which you have taken to bring this, there are many clinicians who just say, what is this? Telemedicine is bakwas. No, it is. And telemedicine is not Neil Armstrong, what Neil Armstrong's heartbeat or anything. It is the first time the telemedicine will be surprised. When Alexander Graham Bell, his assistant was Watson. The first time the acid spilled on his leg. So he said, come here Watson. By that time he didn't know that he has already discovered the telephone. So he said that then Watson said, why are you shouting? Because he didn't know that is the telephone. That's the time when telemedicine first came. Because Bell wanted assistance for injury. So that is the time when e-trauma had come in. But telemedicine must always come out that it is beneficence, it is malfeasance. Because telemedicine will always do best. Telemedicine will do no harm. It is an autonomous practice. Even the entrepreneur, what Mr. Bhagat has thought of, he will have full autonomy to function. And it will give full justice. That justice is accessibility. But at the same time, the entrepreneur or the OTATE must provide ethical, concise, and precision-driven care. If that training can be imparted by OTATE, then you'll be able to provide equitable and accessible health care to the rural mass. And now, about the floods and all these things, telemedicine is the real talisman. It can provide in many disasters, you can give trials. You can do what we call it, predictive, presumptive medicine, all these things will come. That is one end of tele. But you can, at the other end of the spectrum, you can always provide the actual care which is required. And the advantage now, what you are going to create in rural areas, it will avoid misdiagnosis in rural areas. Telemedicine can avoid misdiagnosis. It will stop incorrect referrals. It will reduce nursing time, which time from the complaint to the care. And it will reduce infection. It will reduce transportation. Each transportation in the way roads are there, one is prone to get some kind of a problem. So in this, I must say that the endeavor in which I have been closely associated with Mr. Bhagat, and I'm so glad that he called me over, and many times I've been discussing with him, and in Kalinga Hospital he has already established, and about a year and a half, this is the first thing which was established with Redacol and all this thing, and we have shown it to people that yes, it can work, and the quality is not that let's do it. It can be done, but let's do it is the one which should be the buzzword for all of us. Thank you, ladies and gentlemen.
Thank you, Dr. Mohanty. In fact, he has spoken very useful things about telemedicine. I think many people would not be knowing about it. Its antiquity and its utility, I think both of them. I think that's going to